John, the president receiving his booster shot of the Pfizer vaccine, as federal regulators have now approved that for those age 65 and older. He got the first 2 doses of the Pfizer vaccine before he was even in the White House as president back in December and January. And now he's received the 3rd dose, and he is encouraging others who can get it to go get that booster shot. Kamala Harris, by the way, got the Moderna, so she's going to have to wait, obviously, like others, till that is recommended as well.
All right, let's bring in Fox News medical contributor Dr. Janette Nesheiwat to talk more about this. So the president said, doctor, that the goal is to get more people vaccinated, but how does giving boosters to certain segments of the population assist in that overall goal?
So it's a 2-part equation, John. We do need to remain focused on the nearly 70 million Americans who have not had their first or second vaccine. That's important in addition to ramping up global vaccination. What happens in other countries will affect us here in the United States, even if everyone here in the United States is vaccinated, because of the variants that we see emerging, like the Delta variant. But it is important that we continue to educate and encourage those who are unvaccinated that the vaccine is safe and effective. It can keep them out of the hospital. And we also need to make sure that we have easy accessibility and availability of the vaccine. So we do need to continue focusing on both of those issues.
Dr. Nesheiwat, I'll ask you a question I've heard a lot of people asking as we all get closer to being able to get our booster shots. Some people feel like they want to cross over. If they got 2 of the Pfizer, they hear about the efficacy being higher for Moderna, so they kind of want to get a Moderna booster shot. Do you believe that doctors are going to recommend that, as some people are trying to build their antibodies, or even get a reaction if they didn't from the first 2 doses?
Sure, that's a great question, Sanders. So Moderna is about 5% more effective than Pfizer, but still, all of the vaccines that we have are excellent against preventing severe complications, death, and hospitalizations. Now, I have had some patients who have crossed over that had, for example, 2 doses of Pfizer, and then their 3rd dose was with Moderna. I've had patients that came from overseas that have had AstraZeneca and then had a Pfizer vaccine after that, and they did perfectly fine. But as it is right now, the CDC recommendations are to wait until the data comes out on Moderna and on Johnson & Johnson. And it's not going to be, next year. It's probably going to be just a matter of a few weeks, and we'll be able to get the respective booster dose accordingly.
One of the questions, Dr. Nesheiwat, to the president was, when are we going to get back to normal if we continue on with the vaccinations the way we are? Every day I take a look at the new coronavirus new cases, and the infection curve is definitely on the way back down after spiking from Delta.
Yeah.
So how long before we're back to normal?
Yeah, that's really, really exciting to see that the number of hospitalizations, the number of cases have gone down. We're still at about 2,000 deaths a day, but we do know that the deaths are lagging. Hopefully, this Delta wave might be the last wave that we see for a while if we continue to take precautions, not just with masks and vaccinations, but ensuring that we're doing, routine screenings. If you've become exposed to coronavirus, make sure we have good ventilations, for example, in the workplace or in schools. But hopefully, if we continue to do what we're doing, that we will see improvement. We will be able to return to normal lifestyles sooner than later. And probably if we continue what we're doing, John, we won't have a spike and a surge, which I'm worried about, that we might see in the winter around the holidays. So we just need to continue pushing forward with vaccination efforts, with our precautionary measures, and hopefully, maybe early next year, maybe this spring, we'll be back to normal. But we just got to continue to take those measures that we know that can help prevent the transmission of the virus.
There's also been some frustration from frontline workers who are vaccinated, who want to protect themselves in the workplace, who haven't been able to go get the booster shot. Dr. Nesheiwat, do you believe there should be an exception made at this point, obviously with the approval of the 3rd dose of the Pfizer for 65 and older, for healthcare workers?
Well, sure. Right now, I haven't had any patients, even myself, I haven't had any issues with going out and getting the vaccine. Some places you just have to, make an appointment. And some places, you can walk in, like CVS, Walgreens, those sorts of pharmacies, even hospitals, and I believe doctors' offices will be providing those vaccines now. They already do. So it's just a matter of, finding out where your local supply is and making that appointment and making sure that you get in as soon as possible, especially as we approach the flu season. We don't want to see both flu and COVID spiking up simultaneously. That could potentially overload the hospital system.
Well, Doctor, I like your optimism. Hopefully we will get back to normal by next spring, if not before.
Yes.
Get those masks off yet again and go back to life as we know it. Good to talk to you. Thanks so much.
We will all
Thank you,
cling to that hope.